So I'm Dr. Hamilton Jairaj. I've been working for 14 years as a family doctor and run a very busy practice. And COVID-19 had a great impact on how I deliver care. How do we control disease spread? When it comes to disease spread, one is obviously we know from enough of the public health measures out there that social distancing, wear your mask, no community gathering, all that is great, but people are still going to have to be able to move around, whether that's doctor's appointments, schools, grocery. So all that, what we need to do, a major cornerstone of all of this is contact tracing. It's hard for people to do it manually. It's very labor intensive. I think that's where we need to be able to use technology. So even let's say if I am fully vaccinated, if I am a carrier and I happen to be somewhere and I was carrying the virus, then I would be a source of infection. So contact tracing still has a role even in a vaccinated society. Obviously, we know that there's a lot of vaccine hesitancy, vaccine rollout issues. There's variants that we are talking about. So yes, it's great that the vaccine is here, but does that mean that we are out of the woods yet? No. So therefore, contact tracing is still very, very crucial. I think it's relevant to every industry. It's easier to open things up. It's easier to open businesses, whether that's restaurants or entertainment venues, when you have a scientific proven way with technology that's assisting you to specifically identify the people at risk and isolating them and testing them. At the clinic here, we use TraceScan by FaceDrive. I think I'm wearing the bracelet here. So the way it works for us is we wanted to make it as automated as possible. And we get data every week saying that, okay, this is sort of the high risk, low risk, medium risk sort of exposure that's happening within your environment. So we could change our behavior accordingly, so from a proactive perspective, so that we don't have to shut the clinic in case there's a positive case. But I think by looking at the products that are out there right now, TraceScan has a solution that I'm very comfortable recommending that it's the device to go. The device is only tracking my through Bluetooth any sort of proximity with another person who's wearing the device. Just that. And it's anonymous from the perspective of, my device I think is number whatever, but now somebody who sees number 30 doesn't know it's mine. Obviously, being a true Bluetooth and not a GPS sort of tracker, it doesn't do location tracking. So it's really a Bluetooth signal between two devices, which is obviously a concern for people to say that a device is sort of tracking my whereabouts, which it's not. There's the version 2 of the device coming up, which allows for monitoring of some other parameters for doctors to allow for remote access to care. So whether that's pulse oximetry, which is obviously very crucial when it comes to COVID-19 and post for some diseases, pulse, which gives some more information. And I think they're looking at other sort of modalities for home-based monitoring to allow for better access to care digitally. It doesn't just contact trace, but there's an AI portion that's available that sort of shows behavior among people and kind of identifies in terms of high risks and potential spreads beforehand. And that's amazing that we can do that. That's not something that regular manual contact tracing is going to be able to give us. Contact tracing is crucial for us to get out of this. Why? Because we need to be able to keep the disease spread at its lowest. So for that, we need to identify the high risks, isolate and treat. Manual tracing is very difficult, labor intensive. Something digitized like TraceScan has a huge benefit to doing this in a quicker, more efficient manner, so we can get out of this and get to our normal life.